Aphorism number 93. If the disease has been brought on a short time, or in the case of a chronic affection, a considerable time previously by some obvious course, then the patient or his friends, when questioned privately, will mention it either spontaneously or when carefully interrogated. Explanation of aphorism number 93. In this aphorism, Dr. Henneman has given idea about disease, reason, knowledge. If the disease has been developed in a short time, or in case of chronic disease, it has been developed in a considerable time caused by some obvious cause previously, then patient and his relatives should be questioned privately. They will mention the cause of ailment spontaneously or when carefully inquired. Footnote number 86. Any, any causes of a disgraceful character which the patient or his friends do not like to confess, at least not voluntarily, the physician must endeavor to elicit by skillful framing his questions or by private information. To these belong poisoning or attempted suicide, onanism, indulgence, or in ordinary unnatural debauchery, excess in wine, cordials, punch, and other ardent beverages, or coffee, overindulgence in eating generally, or in some particular food of a hurtful character, infection with venereal disease, or each unfortunate love, jealousy, domestic infelicity, worry, grief on account of some family misfortune, ill usage, balk, revenge, injured pride, embarrassment of a pecuniary nature, superstitious fear, hunger, or an imperfection in the private parts, a rupture, a prolapse, and so forth. Explanation of explanation of footnote of 93. Any causes which are shocking and unacceptable, which the patient and his relatives do not like to admit or accept it, at least not voluntarily, then physician must take efforts to elicit it by framing questions skillfully or by talking with patient or his relatives privately. These may be related to poisoning or attempted suicide, onanism, masturbation, or indulgence in ordinary or unnatural debauchery. For example, sex, alcohol, drugs, etc., etc., excess in wine or any other beverages or coffee, overindulgence in eating generally or in same particular food of unhealthy character, infection with venereal disease, or each unfortunate love, jealousy, domestic misfortune, worry, or grief on account of some family misfortune, ill usage, contradiction, revenge, injured pride, insulted, embarrassment of financial nature, superstitious fear, any imperfection in private parts, for example, gynecomastia, impotency, rupture, prolapse, etc., etc.